Hello and welcome to Health Insights. Today, we're tackling a topic that's on the minds of, well, many men in their families, prostate cancer. Other than skin cancer, it's the most common cancer for men in the US. But, and this is important, there's a powerful story of progress here.
That's absolutely right, Alex. The landscape it's changed dramatically. Thanks in large part to early detection, deaths from prostate cancer have fallen by nearly 50% since the early 90s. But how we detect it and, who should be screened,
Right.
that's a conversation that has become much more nuanced and personal.
So let's start with the basics. When we talk about screening,
Yeah.
we're talking about looking for the disease before there are any symptoms, right? And the main tools have been the PSA blood test and the digital rectal exam, the DRE.
Exactly. But let's clarify what the PSA test really is, because there's, a lot of confusion. I like to think of it not as a cancer test per se,
Okay.
but as a highly sensitive prostate alarm. PSA, that's prostate-specific antigen, is a protein made by the prostate. So if the level is high, the alarm goes off.
But that alarm doesn't just signal cancer, does it?
No, and that's the crucial point. The alarm can be triggered by a number of things: a benign enlargement of the prostate, an infection,
Wow.
or even, recent physical activity. It simply tells us something is happening with the prostate that warrants a closer look.
Okay.
It doesn't tell us if it's a tiny, smoldering issue or a serious spreading fire.
That's a great analogy. So who should be paying attention to this alarm? Is it like for every man over a certain age?
Well, this is where the thinking has really evolved. We've moved away from a blanket recommendation. Now, guidelines from major health organizations, they emphasize shared decision-making, especially for men between 55 and 69. It's a conversation you have with your doctor.
And what goes into that conversation? What should someone be, thinking about?
Well, you discussed your personal risk profile. This includes your age, of course, but also family history. Did your father or brother have prostate cancer?
Right.
Your ethnicity plays a role. For example, African American men have a higher risk. And then there's a critical, very personal question. If we found a slow-growing cancer, would you be comfortable with active surveillance, just, monitoring it closely?
Yeah.
Or would you feel compelled to treat it? Because the potential side effects of treatment, things like incontinence or erectile dysfunction, they're real.
Wow. Yeah.
So we really want to avoid treating cancers that may never have caused a problem in the first place.
It sounds like the goal is to be informed,
Yes.
not just, automatically tested. What about on the prevention side? I see the information from Fred Hutch mentions diet.
Yes, and this is so empowering. While we can't control factors like our age or our genetics,
Right.
we can control lifestyle. Research suggests that a diet rich in plant-based foods, fruits, vegetables, whole grains, and lower in red meat and high-fat dairy can be beneficial. It's not a guarantee, of course, but it's about lowering your risk and promoting overall wellness, which also helps you stay strong if you ever do face a diagnosis.
So the big picture here is that this isn't a simple checklist.
No, not at all.
It's about a partnership with your doctor to navigate your own personal health journey.
Precisely. It's about moving from a passive, get screened mentality
Yeah.
to an active, let's make a plan approach. It's proactive, it's personalized, and it's saving lives.
Now, here's a question we'd like you to think about. Knowing that screening is a personal choice with benefits and risks, how does this change the way you might approach your next conversation with your doctor about preventative health?